Welcome to MedEvidence, where we help you navigate the truth behind medical research with unbiased, evidence-proven facts. Hosted by cardiologist and top medical researcher, Dr. Michael Koren.
Hello, I'm Dr. Michael Koren, and we have a stat episode of MedEvidence. And as the executive editor of MedEvidence, every once in a while, a public health issue will come out, and I want to get a quick read on it. And I'm very fortunate to have a fabulous key opinion leader, Dr. Bharat Misra, joining me today, who's a gastroenterologist and a colleague in research. And we're going to comment today on the Surgeon General's recommendation that there be warning labels put on alcohol because of epidemiological data showing an increase in certain types of cancer, particularly GI cancers related to alcohol use at any level. The argument is that it starts at a low level of use of alcohol and increases as the amount of alcohol use is increased per patient. And Bharat and I have already had a little bit of an offline conversation about this. I come at this question as a cardiologist and a researcher, and Bharat comes at it from the point of a researcher and a gastroenterologist. And we want to have a little discussion around this issue because it's created a little bit of a stir, I would say. And I'm not sure that rank and file physicians are all that comfortable saying that we should have warning labels on alcohol. So Bharat, just quickly introduce yourself to our population who have seen you on other podcasts, but just remind them, and then we'll jump into the discussion.
Hello, Mike. It's a pleasure to join you today. My name is Bharat Misra. I'm a practicing gastroenterologist with the Borland Brewer Clinic. I also do some clinical research. We have an organization, Encore Borland Brewer Clinical Research, where we do phase 1 to phase 4 clinical trials. But at heart, I'm a practicing gastroenterologist. So I'm very excited to join Mike and discuss this new guidelines and alcohol in general.
Yeah, well, Bharat is a fabulous and brilliant clinical researcher, so don't let him fool you with his modesty. So I just want to put that out there. So, okay, Bharat, let's just jump right in. So the Surgeon General, Dr. Murthy, came up with his recommendations based on years of epidemiological research with the concern that any level of alcohol use is associated with an increase in cancers, particularly GI cancers and breast cancer, in fairness. And so give us your immediate reaction to that, and then we'll dive in a little bit more.
So this guideline came out, I believe, last week, and I think it caught most people by surprise, including myself. I treat a fair number of patients with liver disease and pancreatic disease with alcohol. And when I was in training, I ran the alcohol rehab program. Hospital, so I'm really familiar with the extremes effects of alcohol. But this guideline caught us by surprise because what the Surgeon General said, and there is some data to support that even what we consider moderate intake of alcohol is associated with an increased risk of 7 cancers. Most of them are upper airway and gastrointestinal. They include larynx, which is the voice box, pharynx, which is the part in the mouth right behind the tongue. It includes the esophagus. It includes the colon and rectum. And surprisingly, it also includes breast cancer. So the new guideline suggests that we should be warning our patients and the general population that what they consider as very modest social levels of alcohol is actually associated with an increased risk of 7 cancers. And that is the sum of the guideline. And we're going to tease it out a little bit today as we talk.
Right. And historically, we've been taught as cardiologists and people who are interested in cardiac epidemiology is that moderate or less alcohol use actually has a net cardiovascular benefit. And this is based on some epidemiological studies. And Bharat will talk a little bit about some people who are questioning that information. And I think we both agree that there's a potential trade-off between cardiovascular benefits and other problems. I think we all acknowledge that heavy alcohol use is associated with lots of problems, obviously liver disease being a huge part of what you do day to day, Bharat, and other problems. But is there a subtlety here that we need to tease out? And is a public advisory about alcohol really in the best interest when maybe some patients are more prone to GI cancers and others may be more prone to coronary disease? But before we get into some of those details, just define for everybody what an alcoholic beverage is so that we're all talking about the same page, because I think part of the controversy is how you define alcohol use to begin with.
Yeah. So for most people, one drink, for men, for example, the current guidelines recommend that up to 2 drinks a day or 14 drinks a week is considered moderate and acceptable. For women, that's half the number. 1 drink a day or 7 drinks a week is considered an acceptable limit. The problem we run into, Mike, and we were talking about this before, is how we define this. This varies from country to country, place to place. For example, 1 glass of wine, which is considered a single drink, is only 5 ounces. And Mike just mentioned that his bartender at the Inn Club is usually much more generous than that.
It's true.
So what has
I love the guy.
kind of crept up as to, so when we say 1 drink, we may be doing 1.5 or 2 drinks. But that is what is considered normal. And here's the striking thing about the Surgeon General's warning. We know that excessive alcohol is a definite risk factor for many cancers. The Surgeon General is saying even moderate amounts of alcohol increases your risk. And I just wanted to throw out some numbers because I have the report in front of me. So, for example, in the United States, according to the Surgeon General's report, 100,000 cancers are associated with alcohol, and 20,000 cancer deaths are related to alcohol. And this is just alcohol. So, for example, if you take traffic fatalities, 14,000 traffic fatalities are associated with alcohol. So the numbers are somewhat striking to me as a practicing physician. And so this is why this guideline is very interesting, and I'm glad to be discussing this. This is what most of us do. I like my Chardonnay on the weekend, and now I may be a little worried about having a couple of glasses. But
we'll have to get you drinking some red wine. But
Mike, that's right. So there is a lot of nuance to this, and we're going to talk about it. But in summary, the Surgeon General's report indicates that moderate amounts of alcohol is associated with 7 different cancers. And the surprising thing to me is the association with breast cancer. So, for example, women who drink 1 drink a day, they're about 11% increased risk of breast cancer. For 2 drinks a day, that's like 15% increased risk. So, in fact, of all the cancers, breast cancer has the closest association to moderate alcohol intake. So women especially need to be listening to this podcast and taking it, and looking at the data along with their doctors.
Yeah. So, and just to repeat what Dr. Misra said, 1 alcoholic beverage is currently defined as 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of a spirit. And there's other alcohol that falls in the middle of those ranges. But so the type of alcohol you use, of course, is important. Alcohol, remember, is actually a chemical, ethanol. It's a 2-carbon chemical that has a hydroxyl group on it, going back to my old chemistry days. And like anything, it should be considered a substance, a drug, something that may have different effects at different doses. And that's one of the important take-home lessons in medicine in general, is the dose matters. The devil is in the dose. So I think that's important. And the last fact we'll just bore you with is that one of those equivalents of an alcoholic beverage is equal to 14 grams of pure alcohol, of pure ethanol. So just get those statistics out there. So let's jump into the controversy now. So from a cardiovascular standpoint, we believe that there are benefits to using alcohol at moderate or less levels. And some of the data that have come out have actually suggested that people live longer if they drink a little bit compared to people who don't drink at all. And there's also this notion that maybe when some of these studies were done, that they were looking at people who were abstaining from alcohol in a different way than they should have, because some of these people who abstain from alcohol have had problems with alcohol in the past. So I don't know if you want to jump into that concept a little bit in terms of how difficult it is to do epidemiological studies given those concerns.
Yeah, Mike makes a very good point. So my reading for this podcast showed that there are actually only 2 randomized prospective, that means looking at patients going forward for alcohol, that are more than 1 year in duration. And that's the best way to get data. So most of the studies are retrospective. In other words, they call patients, they collect information from charts, and then they see what kind of diseases they got. So we know that retrospective studies, that is looking back, there are so many other possible explanations that have not been included that the data is less reliable. But having said that, that's all we have today. In other words, the vast majority of data on alcohol is retrospective. So, for example, and then they looked at all these retrospective studies and they did put them together and analyze them together, something called a meta-analysis. And the largest meta-analysis included about 110 studies. And that showed the same thing, that even modest amounts of alcohol is associated with an increased risk of these 7 and a few more cancers. And so by putting all these together, you make the study more powerful. In other words, more likely to be an approximation of truth. So the bottom line is that we don't have great studies, but what studies we do have confirm this association.
Right. So let's help people with the numbers a little bit, because in some sense, epidemiology is a numbers game. So we know in the United States, for example, that heart disease is the number 1 cause of mortality. People die of heart disease and stroke more than anything else. We know that cancer is number 2. Actually, stroke is considered number 4. They separate heart disease and stroke. And we know that, for example, probably between 700,000 and 800,000 Americans die of cardiovascular disease each year. And you mentioned some numbers that maybe alcohol is associated with another 100,000 deaths in the U.S. related to cancer, if I heard your statistics correct.
100,000 cases and 20,000 deaths per year.
Okay, so we'll take the 20,000 death number. So just from the pure standpoint of the mathematics, if alcohol was associated with a 10% reduction in heart attacks and heart disease deaths, that would be a net positive of 70,000. And so this whole concept of trade-offs in different populations becomes really super interesting. And to your point, we don't know these numbers exactly. It's all guesswork. And the other piece that's really difficult is to sort out what the fundamental problem. So I read some of the studies that you mentioned, brought in terms of the increased risk. And it's a little bit hard to sort out the independence of alcohol versus cigarette smoking, versus depression, versus other things that are contributing factors, family history, et cetera. And the researchers make some effort, but we all know that when you're looking at retrospective analyses, that it's a model. It's a bit of guesswork. So I don't know if you agree with that point, but I think it's an important point to help people understand.
Yeah, I agree with it. In other words, all retrospective studies, even prospective studies, are not the whole truth. They have their limitations. And, Mike's point about the cardiovascular benefits are very, very important. So the point I would like to make there is that I have a strong family history of heart disease. And I have an uncle who, when I go to his house, he serves like 1/4 of a glass of wine every night, and it's red wine typically. And nobody enjoys having dinner at his house for that reason. Well, it turns out he's right. The ideal amount of red wine that has been shown to be beneficial for heart disease is 6 grams. And remember, a glass of wine, 5 ounces, is about 14 grams. So it's actually less than half a glass of wine every day.
So he serves his wine like a pharmacist.
Exactly. And by the way, if you want the cardiovascular benefit, I think you should be doing it like that. In other words, once you exceed about 10 to 14 grams, then the actual benefit declines. So there is a lot of nuance in this. And I think our job is to help our listeners, and for me, eventually to help my patients do the right thing. So the picture is not as clear as we'd like it to be, but there are some concerns coming up.
What are you recommending to your patients? Have you seen patients that have brought this up to you in the past week?
Not in the last week, but remember, I'm a gastroenterologist, and the second most common cause of cirrhosis in the United States is alcohol. So I see that very common. The most common cause of damage to the pancreas is alcohol. So I see a lot of patients who are heavy users of alcohol. But I haven't brought up the risks of cancer with moderate users. One of the things I'm learning is that I may have to now. I may have to bring this up. To me, after I've spent the last 3 evenings for a few hours every day looking at the data, and the thing that it has done is this guideline has taken away the halo effect of alcohol. So in other words, I'm still going to drink alcohol occasionally because I enjoy it, but I will not delude myself that its benefits are more than the risks. And I'll talk about it a little bit later. One of the problems with being a specialist is we know more and more about less and less. So Mike is a cardiologist. He happens to be my cardiologist, and his points are very clear. There are clear cardiovascular benefits to alcohol. If they're real or not, we don't know, but the data points in that direction. I look at more GI cancers, liver, and pancreas. But sometimes we have to step back and look at alcohol as a whole. And when you do that, then the picture becomes, I think, a little more clearer. And I'll make that point a little later in the podcast.
Sure. So do you have any specific recommendations to patients as of now based on what you've read?
So again, this podcast and post, probably my recommendations will be different. The first recommendation I'm going to tell patients, including my 23-year-old in college, is that if you don't drink alcohol, don't start drinking it thinking that it may be more beneficial than harmful. I think that, including American, the cardiology societies are also on board with that. In other words, the net effects of alcohol may be negative. So if you're not drinking, you don't enjoy it, don't start it. The second thing I'm going to recommend to my patients going forward is, I think what we call moderate alcohol has to be decreased from 1 a day for women and 2 a day for women to 1 a day on the weekends or 2 a day on the weekends, and give yourself alcohol-free days. So for example, and I follow this for myself, don't drink alcohol on the weekdays. It makes the weekends more pleasurable, and I think you're likely to prevent some of the downsides by doing it. So for heavy alcohol, of course, we tell patients not to do that ever. But even for moderate alcohol, I'm going to start recommending to my patients that on weekdays, they abstain. Your thoughts on that, Mike?
Yeah, I think you made an interesting point that when we talk about alcohol use, we almost always talk about it in terms of weekly use. And I'm with you. I don't use alcohol every day, but I do enjoy my wine. More of a red guy than a white guy compared to you, but I do enjoy my wine with dinner periodically when we go out. But I certainly don't even come close to drinking every day. And that I think there's something to be said about using alcohol periodically rather than as a daily, quote, medication or a daily stress reliever. You know, the old concept of coming home and having your martini to relax may have some social connections with your partners and maybe a nice way of doing of separating yourself from the stresses of the workday. And I get that, but don't do it for health reasons. So I don't disagree with you on that concept. But I'd also say is that there's a lot of stuff that we just don't know. So we're making guesses here. We really don't know if there is a difference between taking one drink 7 days a week versus taking 7 drinks every other day in total. So we just don't understand enough about the doses to make strong recommendations. But I don't disagree with the concept that you don't need to drink every day for health reasons. So I would agree with you on that.
Okay.
So let me answer the big question. Just jump right into it. The Surgeon General has asked Congress to put warning labels on alcohol. How do you feel about that?
Again, if you had asked me that question last week, I would have said that's overkill. But now that I'm actually looking at the data and the numbers, I am not opposed to it now. And as you all know, our next president is a famous teetotaler. His brother died from alcoholic liver disease, or he suffered a lot from alcoholism and dependence. So I kind of, at least, so the way I would put it is, how does the average Joe know about this? Most of them don't listen to our podcast. They should. They'd learn all, but they don't. So most of them are getting limited information. So I suppose it would be reasonable to put a modest warning on labels. I don't know if they make a difference, but at least you've given them a chance to know about it and then educate them a little bit that way.
Okay. Yeah, I might disagree with you a little bit on that. So in the MedEvidence world, in our educational environment, we like to talk about net health benefits. And I think anybody that listens to our discussion would hopefully agree that while there are some risks of the use of alcohol that I won't argue with, it's really hard to know whether or not there's a net health benefit. And then, we're not even talking about some of the psychological benefits, the social benefits, and the other thing. So do you really want to put a warning label, quote unquote, on something where you don't know the net benefit? Obviously, when it comes to cigarette smoking, for example, there's no question that the net effect is negative. No one can argue with that. But alcohol is just definitely much more subtle. So I would support something that says, please speak with your physician about the use of alcohol to see whether or not you're at higher risk for some of the complications associated with it. But to put a general warning on it, to me, just feels wrong. And it also, I think, takes away from the doctor-patient experience where individual physicians who have the best interest of their patients at heart can say, hey, you know what? You're at much higher risk for heart disease than you are for esophageal cancer or breast cancer. So I don't really have a problem with you using 7 to 14 equivalents of alcoholic beverages over the course of a week, whether you're female or male. I'd be okay with that concept. The flip side is somebody that may have a really strong family history of esophageal cancer and other risk factors for esophageal cancer, say Barrett's esophagus or severe reflux, et cetera. That person probably needs to hear, I don't think the alcohol is going to be the best thing for you. And I think the net health benefit is probably going to be negative in your case. So I'd like more to encourage that discussion between physicians and their patients rather than some blanket statement that puts out a warning on a product that has an unclear net benefit or risk when you look at it in totality.
Got it. I agree with that. I'd like to clarify my stance and tell you why I'm now, as I said, alcohol has lost its halo effect for me. So we just talked about the increased risk of cancers. but alcohol is the second or third most common cause of liver disease in the United States. It's the most common cause of pancreatitis in the United States. It can cause kidney dysfunction. My younger brother, every time he has a glass of wine, he gets gout. So that forces him to be. So alcohol is a risk factor for gout. It also causes bone thinning a little bit. But more important than that are the social effects of alcohol. So if you look at motor vehicle accidents, as I'd mentioned, there are 14,000 fatalities associated with alcohol. For example, if you look at domestic violence, at least half of all domestic violence includes alcohol. A quarter of all rapes include alcohol. And maybe about half of all suicides are associated with alcohol. I make this point because, we live in a higher socioeconomic strata, and you don't see this a lot in Ponte Vedra Beach, where I live. But amongst the population that is not as wealthy, more middle class, more working class people, these effects are very prevalent. And I had not thought about it until I read for this podcast. So to me, as a physician, I think the data is very strong on the social negative effects of alcohol. And I think similar to guns, we need to educate our patients and then the average public about this. Now, I'm not saying we need to bring back prohibition, but what I'm saying is that many patients who consume alcohol are not aware of the total picture of the damage that alcohol does to your health, to your relationships, and to the society as a large. Now, it has that terrific social lubricating function. It is very enjoyable. So there are benefits. And I think most people are aware of the benefits because you have a glass of wine, you're immediately aware of the benefit of alcohol. But most people are not aware of the downsides of alcohol. So again, it's we need to educate and have adults make their own decisions about what they should do.
Yeah, and by and large, I agree with you. Education is good, but you have to be careful about associations, and that's important. I think there's been a lot of awareness in recent years about drinking and driving, and I think we've made some progress with that. But here, I'll give you an association that you probably never thought of, that every major peace treaty that has been signed has been celebrated with a champagne toast. And so I would argue that all the great peace deals are associated with alcohol use. And so that's an association as well. So you always have to be a little bit careful about cause and effect in associations.
Absolutely. And you're right. I think, again, as physicians, we may be focusing on alcohol too narrowly. We're focusing just on the health benefits, but there are social benefits to alcohol. For example, when I'm more of an introvert. So when I have to go to the gut club or a research meeting, there is nothing like a glass of wine to make me more comfortable. And I can tell you, I'd go to very few meetings if it was not for that. So I agree with you. I think the jury is still out. And as I said, each person has to make their more decision. And, those of you who know Hegel knows that, everything goes in pendulums. You have an idea and then it swings to the other extreme and then it comes to the middle. There is thesis, there is antithesis, and then there is synthesis. So I think with alcohol, at least recently, the pendulum is swinging in the other direction. And how far it will go, we don't know. But it's an important discussion because it's an important part of our life, and we need to know these facts.
Yeah. So, and I like what you're saying. And again, I love the concept that people should be talking to their physicians about their individual risk and how they use it. I think that those are great conversations. But I also don't want to get into political correctness, which I think is really important. So I'm worried that somebody's going to come up with the idea that we have to change the name of happy hour to cardiovascular prevention hour or GI risk hour. And I don't think we want to go down that road. We still want to be able to function as human beings and enjoy some special times together. So Bharat, this has been a really wonderful conversation. And I want to end it with one last concept that I think you'll agree with. You started the conversation by saying there weren't a lot of good randomized studies that look at these issues. And that's what we do every day. You and I are part of these randomized studies, and we can do these longitudinal studies in a randomized fashion that would be much more rigorous than the epidemiological studies that we're relying on for these kind of recommendations. So, for example, what would you think about a study where we took 50,000 people who either had lower or upper endoscopy that looked basically clean, and then tracked their alcohol use over the next 5 years, and then determine what the risk would be of alcohol use in a group that was clearly defined as not having a cancer at some starting point. And in 5 years, we can have a lot of information, and we could do the same thing for women in breast cancer with mammograms, or the same thing for people that had clean heart caths, or something where we're starting from a baseline that's knowable and see what the risk is over time based on more careful reporting of actual alcohol use. What would be your thoughts around something like that?
I find that very exciting. I think that's a great idea, and that's why I think you're such a good researcher.
Any final comments for the MedEvidence audience?
No, I think the bottom line is that, again, I've made this point many times. When I've even though I'm a practicing gastroenterologist, I've actually, until the last 3 days, I've not sat down and read about the data on alcohol. And there's a considerable amount of data. I was not aware of that. And I think it just makes you a little more cautious, that's all. And that's a good thing. The knowledge should drive us in the right direction. And I'm hoping our listeners will now go to good websites and look at the data and make their own decisions.
I love it. Cheers to that, my friends. Thank you for participating. This is 100% water, just to make it clear.
Same here. Tap water, by the way.
Absolutely. Again, thank you for being part of the MedEvidence family, and we'll do another podcast soon.
Thank you, Mike.
Thanks for joining the MedEvidence podcast. To learn more, head over to medevidence.com or subscribe to our podcast on your favorite podcast platform.